Good morning, our lovely people. We're happy to have you today. We are back with your show, The Scorecard. As you well know, on Mondays, Monday to Friday, we're always here having the topical discussions on things that are shaping the nation. We welcome you from Wide Awake with Mr. Alex Sembwa and Virungi Stella as they lighten up your morning. Today is another day, though the difference with today is kids are not in school, they're back home with parents. There was a discussion on Twitter that parents should remember that when schools close, that's not when learning ends. Even at home, children should be in an environment where they're learning something, they're doing something. Most of you forget and let children only do holiday package and cartoons. But we hope in this period we can incorporate time within parents and their children. So today is a Monday. We are with Honorable Margaret. We are going to be tackling a thing or two, but we shall start with the issue of the medical internship doctors. Now, they hate being called medical internship students because they're not students, they are graduates, but they're on the internship program. And there is a strike going on. Last week, the Minister for Health, Dr. Chris Beryomunsi, was informing Parliament that the medical interns are supposed to report to their duties. But the difference this time is government-sponsored medical internship students will be receiving an allowance, and privately sponsored students will not be receiving an allowance. And then also, the leadership of the medical internship doctors said they will not accept that, and they pronounced a strike. And now also the Uganda Medical Association joined the strike. Those are interesting texts, and right now we are having that crusade of corruption going on. And if you have an industrial strike here, and then you have a crusade that is going on, and I was seeing Honorable Namere was in a pharmacy, I think, busy questioning the people who are in charge and all that stuff. Very interesting things going on in the country. The other discussion we shall have is the directives that were given by the local government minister, Honorable Bargahare, and a lot is going on with that discussion. We had it last week with my colleague and a lawyer friend of mine, Tare, but still we shall have a little dive into it with Honorable Margaret today. Calvin Mahouz is my name. We welcome you on the show. Honorable, we're happy to have you today.
Thank you. Truth. I always start with something. This time I just want to start with friends. Friends should not be, because the world perceive you by the choice of friends you make. And friends are really very important, because you need one. You need a friend. You need friends who will be with you, who will believe in you, who will accept you, who will not be jealous of you. Friends who will accept your word when the whole world is refusing you. So there are few these days. There are few friends, because they are not friends. Some are friends of benefits. Some are friends on a mission. Some are friends with crime. Some are friends because you're colleagues. There are so many reasons. But you need that friend who will understand you, because it is very important to have a friend. Because people are in prisons because of friends.
True. People
have died because of friends. People have big posts because of friends. People have you've made mistakes because of the collaboration with friends. Some people's dreams are shattered because of friends. People are married because of friends. People are divorced because of friends. So friendship, shouldn't take friendship lightly. We should really give it a big. But I have only one person who can make for you friends, and that's God. Because if you don't have such a friend, ask God for one. And ask God to make you discern that these are the right friends, these are are not the right friends, these are good friends, these are the right friends. I've seen people suffering with things. They can't talk anything because they don't trust anybody, because they are there just, and they cannot. So one thing, you should make God your friend, which is okay. And for God to give you a friend, you have to be pure and with a good heart. Okay. And it's only God who gives friends. I've seen people, Calvin Nga, are funny, a problem solved, a problem shared is a problem solved. Ogenda n'ogula loozi yo nga talina gw'ogibulira is what? Has never been your friend. What is that car?
Rolls Royce.
Oh, that one. That's my dream car. That's my dream car. Lord, give it to me if I come to meet you. So really, that's that with friends. To my viewers, just a kind reminder. I love you guys.
When we're starting with the issue of medical internship, you know, one of the challenges that I had a discussion before with the leadership of some of these people, and they're saying we have medical schools in the country have become very many, and you cannot stop people from doing the course they want to do. Government takes in few numbers, but then there are other medical schools like Kampala International University, not in bad faith. They take in a certain number because they can't afford having them on board. Are we looking, the perspective of this strike, are we looking at it from a wrong perspective? Because now these ones are done with school. Let's look at the issue of before they even get to the level of graduation, the issue of the numbers of the doctors we have on the market now.
First of all, as far as medical is concerned, medical cases are different. Because medical, in this world we live once. I don't know, but there is no supermarket you will go to buy life. There is no supermarket you go to buy spare parts of life. Because me, what I see is this medical thing should be taken very serious and of very importance, because we live once. You just go and die, and it will be bad. So, but you are saying there are many doctors and so. But what ratio is it?
Yes.
The ratio is. The other time they were saying about to 25. What?
The ratio of a doctor to yes.
It is still. You see that even when we have doctors, it is very difficult.
It is one doctor serving almost 24,000 people.
So, I hear government, because it can be very expensive, because like intern doctors, they are more than 2,000. They are more than 2,000, which is a lot. But why can't government work it out really and see to it that as far as health is concerned, we are done? Because health gets like 8 trillion. Okay, it is underfunded. But the issue of removing allowances from intern doctors can be fatal. Have you ever gone to those hospitals when they are on strike and you have a patient? It's not good news. Me, I'll give you an example. I didn't like ambulances at first. So I would always complain, ambulances, why? But But one day, my dad got an accident and we had to get him from the village to Mulago. I saw how the tension I had. Because any delay to work on that person can be death, can result to death. And death is different. It's not normal death. Social science, but death, and you don't live anymore. You don't know where you're going if you're not born again. So really, I think from there, ambulance in Jirabire, and
yes, you're giving it space.
So if you're taking your patient to the hospital, taking a person to the hospital, first of all, you are in pain. Those referral hospitals,
Yes.
Those referral hospitals, referral, and then the Mengos, the Interkaya, the what. taking you a person there, because we always do self-medication in most cases, by the way, just call your doctor
yes.
or self-medication. But as long as you go there, you have a problem. You have an issue, which is very urgent and important. But going there and meeting a doctor who is hungry, with your pain, who is hungry, he has not eaten, your pain, it can really be a commotion. So what am I saying? I'm saying ebyo should stop. It should really stop. Because I was annoyed with Dr. Bariomunsi, because I know Dr. Bariomunsi, by the way. And the way he talked, it's not him. Because he can't say that. He knows what those people do. Those medics know what they go through. Because medical doctors, the real medical doctor, the practicing one,
yes,
don't see all the patients. All the patients end up being seen by what? By intern doctors. So Dr. Bariomunsi, really, they are using you. It's only this time I'm telling you, do the right thing. Do the right thing and trust God. Because it's not in order to leave a medic to suffer like that.
No. The Uganda Medical Association is making demands of, the president made a directive in 2021 that the money be increased from 1 million to 2.5 million. And right now, they say they don't have money, so they are saying, we are not paying you, or we are paying you 1 million. So Uganda Medical Association is saying, you either increase the money from 2.5 to 4 million, or maintain the 2.5. But now, you have deployed, they have deployed 2,417 medical internship doctors for 2026-2027, the internship period for doctors. And when you look at the 2.5 million, that is going into approximately around 30 something billion. Now,
per what? Per month? Per year?
No,
per...
the period, the year. Is it sustainable, especially for our government? Because we have looked at it from the point of they need the allowances. But as a government and the priorities we have as a nation, is this also supposed to be one of them?
I've not seen Minister of Finance in this debate. I don't know what they are thinking. I don't know what. But in most cases, we hear URA has overscored. It has hit the target and all. They are donations. They are donations left, right, and center. Corruption. People in Luzia with billions on their heads. Me, what I think, Minister of Health is poor planning. I think there should be a planning for these intern doctors.
When it comes to the intern doctors, I want us to look at maybe what can be done to help them. Because 2,417 is a moderate number. Because when you look at where they're doing internship, there is a shortage of qualified doctors. So the doctors on the internship are doing most of the work. So we need them. So how does government rectify this problem? Because we're already there. The ones that, because there is that imbalance, the ones that are privately sponsored, you are not going to be paid. The ones that are publicly sponsored, you are the ones who are going to be paid. Where is the equality, especially when it comes to the rights of those doctors?
If they do that thing, they will have done a very wrong thing, because they're all doctors.
That's what actually the minister is proposing, that those that are on government sponsorship, they are going to be paid their allowances. And those that are privately sponsored are going to have to bear the costs of the period, the 1 year period.
Wow. Doctors, excuse me. Those doctors, we should really respect doctors, because 5 years, 6
years.
6 years. Our bachelors, no bachelors, is 3 years. After 3 years, you get a job, you marry, but doctors continue. 4th year, 5th year. And it's a lot. Those private sponsored doctors the parents, okay, maybe the parents who are going through that sponsorship of what, it's very expensive.
That's actually where my question is going. Looking at it from a perspective of a parent, you have invested money in university tutoring, and you're taking the person to school, and now the government is telling you even the internship you're going to bear. For example, if you have been studying from KIU in Ishaka, they have taken you to Karamoja. You have to feed, you have transport, you have where to stay. As a parent, the viability of this program, especially parents who have doctors, people who have graduated with doctorate in medicine, a degree in medicine and all that, is it viable, especially for a parent?
It's very difficult for a parent. It's going to be a very big hiccup if they do that. They will not get the results they want. So my appeal to our ministers is, please take them as a whole. You could try, yes. I know you can try to get that money paid. It's not a lot of money.
Yes.
It's not a lot of money. A year, $30 billion for intern doctors for our lives. It's not very big.
We are in a facade of corruption, and we are in that period where the ministers for local government are trying to show that there are lapses in service delivery when it comes to especially the health sector, transport sector, and we have seen these three ministers, the Minister for Health, Minister for Transport, and Minister for Local Government, making sure that they are on ground to balance the equation or to make sure the services are delivered. When we look at the health sector, where Dr. Bariomonsi is now, because he was coming from Ministry of ICT, when you look at the ministry he's heading and the lapses he has in the hospitals he's overseeing as a minister, when he adds on the problem of intern doctors, isn't he failing even before his job starts?
It's not adding on. That problem has been on, by the way. It has been on. Yes. It has been on. I don't know how they solve it, but they somehow solve it, we move, it comes back, they want to remove.
There has not been a lasting solution.
There has not been a lasting solution. But now, we need Parliament to come in, because it's an overseer. Parliament should come in and give a lasting solution to this problem, really, because it's not going to stay like this. And it affects patients, it affects people, it affects Uganda as a whole. So, it is Ministry of Finance.
Yes.
Because I've not seen it in this debate at all.
They haven't talked about the issue.
The issue, it is Parliament. Parliament should come in and solve this matter as soon as possible. It is Ministry of Health, Finance, Parliament, and
Health, Parliament, and Finance.
So they should sit down and solve that problem. But the issue of those are allowances, not salary. They are allowances.
Allowances, yes.
They are facilitation. It's not salary. And they will see a way forward. Another thing I want to talk about salary is the civil servants. Okay, this one is, by the way, salary is very important because the civil servants are not paid well. You find a civil servant getting 2,900,000, but they have a child who will go to a school of 2.5, who will go. So it increases what? Bribery and
the corruption issues.
So I'm saying, you will go in a hospital to see a doctor. You will have to cough something. You go, for example, Mulago. To see a doctor, I've been there, and I'm always real. You have to see, a messenger can take you to a doctor if you cough something. You can give a messenger 10,000 and he or she makes an appointment with you, with a doctor. To see a doctor, you have to bribe your way through, you have to, that kind of thing. Now, if they are not given their nsako, how will it be? How will it be?
When we're looking at the issue of service delivery, the monetary issue is also very important, especially when it comes to payment of salaries. There is a phased plan on increment of salaries, especially when it comes to civil servants. And one of that phased plan, I remember there was a discussion from around 2013 Now, there is the first phase is going to start this financial year. There is an increment in a certain percentages, especially when it comes to certain people who are serving civil service. When you look at the public service website, there is that increment of salary. When it comes to payment and how much money you earn, because I want us to also look at the doctors that have finished and their incorporation into the employment sector. But before we get there, the issue of how much these doctors are earning in public hospitals, does it also affect the services they're giving? Is public service supposed to be a monetary attachment or serving the nation?
Salaries for civil servant is neglected. It's neglected. That's why you see a lot of corruption, because they have to find their way through. You can't tell me civil servant, I'll talk about civil servants because they're the ones I think I'm getting 900. For example, okay, let me say, but getting 900, the big one can get to 1.5. Actually, I was happy when the president started the increment of science students. But of course, he has said he's also going to work on the art students.
With this financial year, they are going to add something.
Going to add. So, my appeal to government is they can't fight corruption. They can't sincerely fight corruption if they don't increase the pay of the civil servants.
Isn't this where now the Ministry for Public Service is supposed to come in? Because we have seen local government, we have seen health, we have seen transport and works, but the Ministry of Public Service streamlining how salaries are got, when they are got, the issue of the minimum wage. These are issues that Ministry of Public Service is supposed to come and be very vocal about. But the minister now, Honorable, the now retired General Katumba Wamala, because he's retiring this week, we haven't seen him, or even the secretary for the head of public service, Honorable Lucina Chobe. We haven't seen these people be vocal, especially when it comes to issue of streamlining how much these people earn, the minimum wage bill, or the minimum wage, especially for all Ugandans. We haven't seen that ministry be vocal on some of these issues. Isn't it also lagging behind and also costing us on the issue of service delivery?
This issue has not been talked about, by the way. They just keep quiet because you pay yourself on voucher. You can't tell me you can get 2 million. You have a family, you have children who go to school, to feed, to what, and you not involve yourself in corruption. So, I don't know about, but I know General Katumba is a performer.
Yes.
And who else?
Miss Lucina Chobe.
Miss Lucina Chobe. I don't know if she can be aggressive enough to tell government that these people need
an increment.
An increment. It's very important.
When it comes, government is trying to subsidize on issues of expenditure and minimizing on expenditures that are irrelevant. But when it comes to payment of salaries, it's very important, because when we're discussing issue of service delivery, people being satisfied with how much they earn stops them from going ahead to elicit money from people to give the services that they're already paid for to do. So, is this an unnecessary expenditure, especially payment of salaries, or it is an expenditure that government should look at if it wants to improve services delivered in public places such as hospitals?
They don't know what they lose if they don't increase the salaries of the civil servants. It's a lot. They were talking about the minimum wage. I don't know what happened to the minimum wage.
The discussion hasn't gone to Parliament.
The discussion hasn't gone to Parliament. But I've said it and I'll say it again. Unless they may not succeed in fighting corruption, because you say do or die. Now what do I do? I have this to do, I have this to do, I have this to do. I have to make sure I use it. I was appealing to government to look into that minimum wage as soon as possible.
Okay.
It will help us live out.
We are discussing the issue of internship doctors. We have those that are finishing and those that are starting. Those that are finishing now are going to work on their qualification process and get licenses and start practicing. The issue of retainment of these young people, we have a ratio of 1 to 24,000 people. One doctor serving 24,000 people. Now we have health center 3s that are down to sub-county levels. that are supposed to serve a certain number of people. And we don't have certain qualified doctors at Health Center 3s. You only find them either at Health Center 4 or at a referral hospital or a general hospital. When it comes to issue of hiring, should that also be a discussion? As we talk about the issue of internship doctors, hiring the already qualified doctors we have on the market to improve the service delivery in hospitals.
Just as I've told you, villages suffer a lot because you can't go take me to Karamoja for just
1 year.
Or 1 million or 900,000 or something. What you'll do, you'll say, Kanjize wane Kampala. You sigenda. Kanjize wane Kampala wankoleka clinic or something like that. So I think the whole issue now is salary. I mean, first of all, they have to pay those internship doctors. Whether they want it or not, because they also graduate from medical school. They have to do that. And then the second thing is to increase the emoluments.
And for the already existing.
For the already existing, yes. They'll see a very big change.
Maybe also the other issue of planning. When we look at it from a country perspective, as a country, why do we always have to go into a problem, then we look for a solution? Why are we not a solution-based nation as Uganda? Why are we always waiting for us to fall into something and then we look for a solution? Why don't we plan better as a country?
There are many factors. But planning is essential. It's essential, depending on the person who is on the planning.
Yes.
The institutions have planners. It's a whole department, I think. Yes. It's supposed to be a whole department. I don't know now. But it is supposed to be a whole department to plan. To plan, to budget, so that at the end of the day, everyone benefits accordingly.
Yes.
But Uganda being what it is, abantu abalala badde bakola kadibengalye. After all, how much do they pay me? After all, hey, let me. Unless we come down and say, God, this is our country. We have to sit down and say, this one has to move. I'm in this position. Just as I told you, you work for God, not for people. I'm in this position. How do I make it better? How do I make the people here better? How do I do it? When you go into a position, research and do what is making these people fail. What is making this problem? How do we plan for this? But in our institutions, I think it is not very there, because you can find a person who goes there and the only issue he or she is looking at is how do ndimfuna much, and with that attitude, will not go far.
Yes. So as a country, especially people that are serving in government, we should change our mindset towards the services we're giving to the Ugandans.
Exactly.
So for them to get a better service, even us as people who are offering the service should change our minds on how we're supposed to deliver the service. Okay, that is actually very good. As we conclude with the issue of the internship doctors, do you think that government is handling this in the right way?
No, because Chris is coming out and saying you threatening the internship. Is that the way to go? No. Threatening the intern doctors. That's not our way to go. He's not there, but he was once there.
Yes, true.
It's not good.
Okay, so they can do better.
They can do better.
Okay, that's very good. We wish the young people who are going to do internship a successful period, but we hope government heeds to the communication and heeds to the plaints that these young people are making, and also the associations of the medical intern, the internship doctors, the association, also the Uganda Medical Association. Listen to these people and have a sit down. We saw it with Dr. General Sacheng. She used to meet these people and they used to talk. The Health Service Commission also should get involved in these discussions. We have experts, especially who sit on the commission, who can look into this matter and let it be addressed. Also the commission in charge of health in Parliament, the committee on health should also look into the issue, address the issue, make a report, present it to Parliament. We need to see our young people better and living and enjoying the professions they practice in the country. Honorable, on the 10th of August, there was a directive from the Minister of Local Government in relation to how business should be conducted in local governments. Now, before we even get into what he was saying, we know local governments are autonomous administrative units and they create their own business. Before we even get to what he said and what he did not say, isn't the minister overstretching himself? Before we even get to the discussion, he's giving business to local governments. Isn't he overstretching his mandate?
No, to me, but he's within the law, because the things that were in the letter are within the law. Like,
before we go to the letter, local governments are supposed to make business, take it into council, and then they debate on it. Now we have a minister who is giving them what they should debate and what they should do. Is that the administrative breakdown we were given as a country with the constitution, or now we're having ministers that are doing things their own way?
No, he's just rejuvenate. He's bringing out what was there.
Okay.
For example, he said, don't drink and drive, excessive drinking, don't drink by 3, don't. There's nothing wrong with that. And I've seen people fight over it because it's normal, it's the way to go.
Very many people actually are dissenting from him. They are not happy with how he's giving business. Because, okay, let's look at some of the directives. One of the directives is transparency and press access to council meetings, where he says the press should access the sittings of council. How will that work out, especially for you?
Balam, Honorable Barugahara, I don't think he's alone. He's on special duties.
Okay.
I think because he has an above somewhere. What he's doing is not within his docket, and he's allowed to do that. And so he always says it that the president, the one who has asked me to do. The thing of committees of press, it's okay. To me, it can be okay. It is it brings transparency somewhere, somehow. It brings transparency. Now, what do you want to hide? What do you want to hide? Why can't the Ugandans know what is there and what you did, what you planned, what you budgeted, what you are doing, and what you're going to do? There's nothing wrong with that. It will minimize corruption.
People feel that most of these councils, especially when you look at the sub-county level, there's LC3 councils, and the ones that are headed by municipal mayors, town mayors, before you go to the LC5 and city, they feel the business that is done there is very minimal and it doesn't actually affect them. Do you feel the directive of the minister involving the press and covering what is going on in these sittings will give people a better perspective of how their councils work and what they actually debate and how it helps them?
I mean, I'm actually in support of it because we need transparency.
Yes.
That's the beginning, that's the starting point. We need transparency from down up to up.
Okay.
What are you hiding that the press is not supposed to see?
Okay. Then the issue of public display of approved budgets and work plans. This one is a good thing. I've already heard you say it, that it is good and it should be adopted. But let's talk about the issue of budgets. I was with the former speaker for March India, the March India division, and he was saying they make recommendations and budgets are passed by KCCA, the city council division. Now, when you look at that kind of preamble, when you look at these lower councils that do not actually pass budgets, what are they going to be displaying? Because most of the things come from district councils.
Budgets, when you're doing budgets, you're supposed to involve all stakeholders.
Okay.
From down, but they don't do it.
Yes.
Most budgets this time it's copy and paste. They just get from the other time. But the whole thing is supposed to be from down You approach everybody, you get to anyone, how much could you need, how much can help you, how much, from down to up. By the time they are there, they have to, all stakeholders have to be involved, but it's not done.
When you look at the issue of work plans, let's talk about recurring business. Carrying business that has happened in the former sittings to the current council. In Uganda, we always have that challenge. Even when you look at I think around the second or third sitting of Parliament, there was an adoption of business that lapsed in the 11th Parliament to be carried on in the 12th Parliament. When you look at the work plans for these councils, some of them are just to make, especially the lower councils, make drainage systems, do silting and all that stuff. Then also the issues of garbage collection and all those things. Some of these are recurring problems in these councils. The repetitiveness of them in council, won't it give a picture that these councils are actually not working, yet this is the way, this is the only work they have as them?
Of course they change, they change them, but you're supposed to hand over. You're supposed to hand over when you leave office. Even when you're supposed at least, you're supposed to come back and say, we did this, please move with this, continue with this one was unfinished, this one is finished. But the problem is, when another person comes, he starts his own and leaves behind, which is wrong. You're supposed to continue as you add yours.
My question was the repetitive business, that if in the last 5 years you are making one trench, yes, and it wasn't done, then it again comes back in the next term and also comes back in the other term. Won't it show that our councils are not working? Yet this is actually their scope of business. If something is not done, it must always appear on the order paper every time they are in a council sitting.
It's supposed to be that, but it's not done. I don't know the reasons they give after saying budgeting for the something, planning for something, and then it's not done. I don't know what reasons they can give for it not being done, but of course they are there. If they are there, if it has failed this time, why don't they make sure that it is done in the next, at least not 3 to 4 times.
Yes.
3 to 4 times becomes so
repetitive,
dangerous and
yes.
repetitive.
Well, when we are still discussing the issue of budget, the Minister of Local Government and Minister of Finance have been working in conjunction. Now we have even a minister for Kampala. So Kampala itself is an administrative unit. But let's focus on local government and Minister of Finance. There is a specific budget they give to these administrative units, which are local governments. And there is a certain threshold, especially when it comes to construction of roads. I think it's around 1 billion or something of the sort. Now, the money they receive and the budgeting itself, when you look at district council's budget for the different sub-counties and all that stuff. Now, when you look at the money they receive, is very small to implement the work plan sometimes they have. How are they going to balance the two, making sure that when they budget, the Minister of Local Government is at the floor of Parliament with his technical people, making sure that they are lobbying for the money to come to the different administrative units that have passed the budgets?
In local government, there used to be a problem of diverting funds. Funds are supposed to do this, and they divert it to do other things. I don't know if it's still there, but it used to be there and it was allowed. But they were trying to fight it. By the time I left, I don't know if it is still there. But if you budget, there's a way they budget. If you budget and plan, that money is, and if the budget is passed, really, it's approved and passed. I don't see how you fail to do something.
What about the money that comes from the central government that is supposed to do work? Because the local governments have also a mandate to collect taxes. But then where we are now, the local government doesn't keep that money. It remits it to the consolidated fund, which is also a problem, because they were saying the money that we collect should be kept in the local governments and it should do the work of local government. Now that money is going back to the consolidated fund, and then now you're supposed to remit it to us. So we don't have specific money that we keep. We all have to remit back the money. So when you're looking at the issue of finances, the local governments, this model, is it sustainable? Because they are planning for money they don't have and they expect it from government, and when the money doesn't come, they will look like they have not been doing anything. Shall we see the minister, as much as we are forcing directives, also lobbying for finances that are enough in the local governments to do the work they have planned for?
I don't know if the honorables, Honorable Vargara and Honorable Namere, I think they have their plan, or work plan. They have a lot of things on their head. But they should prioritize and say, we should start with this one is affecting so much, this one is a what. I can see they are trying to work, but if they can sit down and solve some of those minor problems, minor problems, I'm sure it will work.
The issue of alcohol that you talked about, there are two. One is the protection of children under 18 from alcohol, and then there is also curbing early morning alcohol consumption. The issue of children is a non-discussion. That one, we know we must protect our children, and there is the alcohol control bill that was being brought by the former Tororo woman member of parliament, Honorable Sarah Opendi. Now she didn't come back, but she was planning to, she had brought the bill, but it didn't actually get onto the table because it was resisted by the alcohol production companies. But when you look at the age of alcohol consumption now, it is 18. Certain section of the public is pushing it for it to be increased to 21, like it is in other nations. Would it be actually better if the alcohol threshold was increased from 18 to 21?
Alcohol, I'm a Christian, and my doctrine doesn't. But I have some few words to talk about alcohol. One, it's illegal in this country. It's illegal. And the adult age is 18. I don't know how I don't know how far the government will go in controlling this alcohol, because I'm an adult, I'm 18, I pay my taxes, I do my work, I don't overdrink. How are you going to affect, how can you control my drinking?
When it comes to the drinking, the protection of, because when you look at Directive number 3 of protection of children and persons under 18 from alcohol, that means you're either not supposed to sell to them or expose them to alcohol. But my question would be the issue of having underaged young ladies working in bars, working in those alcohol retail shops, 16, 17, and they are the ones selling the alcohol. How are you going to protect the young people, especially when it comes to slum areas, urban areas? Because the drinking is not only done in bars. There are hotels, restaurants, and all those things. How are you protecting the children?
The government has to come in, because it shouldn't go like, because the policy says, the policy was saying that children not drinking before what? Before 3. Before 3. But look at the children now. The policy doesn't say, the policy doesn't prohibit drinking, but it is against the time.
There are three things in
let me finish. Okay. Let me finish. So, to me, I think for children, it should be prohibited completely. Okay. Yes. And also
which it is. Yes, it's prohibited.
But are you sure they don't drink before?
So the enforcement should be more on the police side.
Exactly.
Okay, so now we have two contentious issues. One is early morning alcohol consumption. 2 is operating hours of bars, malwa joints, and other alcohol outlets. With early morning consumption of alcohol, you only pointed out that this local government leaders shall take the lead in discouraging excessive and early morning consumption of alcohol, particularly where such practices contribute to absenteeism from work, idleness, domestic problems, disorder, or crime. Local authorities should work with police, community leaders, health authorities, and other. Now, I want to look at the wording, particularly where such practices contribute to absenteeism from work, idleness, domestic problems, disorder, or crime. That means you have a specific target of people you're looking at when it comes to early morning drinking. Not all, because when you go to, let's say, tourism sites, and I am a tourist, I am in a hotel, I have my bottle of whatever they drink, they are seated, and you, a police officer, come inside and you're stopping me from drinking early in the morning, will that make sense?
To me, I don't think it makes sense, that timing. The timing is quite weird, because are we controlling the drinking, or we are controlling the places selling alcohol?
So the directive is vague in itself.
I don't know, but I'm wondering, what are we doing? There are people who work at night. Very many people, by the way, work at night. Night economy.
Yes, the night economy.
Who work at night, but you're telling them 3 a.m., 3 p.m., 8. So it may be vague. But that's the law. We have to accept the law and implement
the loopholes. When I look at this early morning alcohol consumption thing, because I see it specifically has a target. Those who are supposed to be at work at that time and they are drinking, that one should be addressed. Those ones who are idle, that one should be addressed. Domestic problems, those who are beating people at home, domestic violence because of alcohol, then disorder or crime. Now, I gave the example of a tourist or a person who has slept in a hotel and they are they are drinking early in the morning. Is it also prohibited? Because if you're saying early morning alcohol consumption, and then also the other issue of bars and malwa joints and other alcohol outlets not operating before 3 p.m., what happens to business owners who have invested in that venture?
And they are paying taxes. Those guys pay taxes, and pay a lot of taxes.
So what happens to them as business owners?
Comes from the same. I don't know, but it has been the law.
No, we operate a free economy where everybody can.
The 3 has just come in. 3 p.m. has just come in.
It has just come in. It's now a new directive.
It's a new directive. But to me, I think the 3 may not help. The 3 p.m. may not help, because if you had stopped real drinking from that time, because the 3 cannot. I remember during COVID, where people were drinking, and business as usual, they go in the bar and they lock them in. There were so many. My friend once told me he bought this drink and drive thing. He bought a Muslim car. So wherever he would be passing, those guys with his Muslim kappa, with bogoya on the way, to say, Haji, itao. We are dealing with human beings who have a lot of knowledge, who are wise. So to me, that business of 3 p.m., I think 3 p.m., it may be there, but it may not help a lot, because it will be controlling just those people who are selling, and it will not affect these guys.
Okay. We have been with Honorable Margaret discussing issues of national importance and having a few discussions that shape the nation. The show is The Squad Scorecard. Calvin Mahuz is my name. Have a very beautiful morning.